Back now, 8:11 with your health at 8.
This morning, we're getting some actual answers to the top health questions that Americans asked Google in 2019. Here with both NBC News medical correspondent Dr. John Torres. So this is something that a lot of folks do.
Yep.
You know, you have a symptom or some symptoms and you go to Google and you're like, oh, what? So we thought it'd be nice to actually bring in a real doctor. So I'm, again, asking for a friend.
There you go.
Alcohol. Well, apparently, this is like one of the top questions. How long does it stay in your system?
And this is definitely one of the top 10 questions. And you can imagine January 1st, people are waking up going, how long does it take to get alcohol out of my system? It depends on what you drink. So if you're drinking alcohol, on the average, our liver processes about 1 drink an hour. So you can't get any faster than that. If you drink 4 glasses of wine, guess what? It's going to take 4 hours to get those glasses out.
Okay.
So again, cumulative.
It's cumulative. Yeah, basically, it just goes at a drink an hour, no matter what you do.
That's interesting.
All right. Does it depend on how much you weigh, though? Or?
It depends on how much you weigh, it depends on your age, your gender, and it depends on the alcohol content of the drink. Not the drink itself, but the alcohol content. And so the stronger the alcohol, obviously the longer it's going to take. Right. But on the average, it's 1 drink an hour.
Does it make a difference if you've got a full stomach or an empty stomach?
It does, because it absorbs a lot slower that way if you have a full stomach. So these can all help, but at the same time, on the average, just think a drink an hour.
All right, next question. Everyone wants to know, how long does the flu last?
That's a good one.
And here you can imagine people are sitting there feeling horrible, going, how long does it last? What can I do? On the average, it lasts about 5 to 7 days
5 to
overall.
7?
If you've gotten the flu shot, it's not going to last quite as long and it's not going to be as intense. And there are medications that can help. Great medicines that your doctor can prescribe you. They work best if you can get in within 48 hours to get those. Again, it's a perfect time to get the flu vaccine right now before you travel, and that can certainly help if you do end up getting the flu.
Not too late.
If you're older, like I got that senior flu shot.
The double dose vaccine.
Why didn't everybody just get that?
Because most people don't need it. If they're under the age of 65, you don't really need it. Above 65, they recommend getting that. So.
Here's a fun one. I think this is interesting. People are Googling how to get rid of the hiccups.
Yes.
I mean, everybody has their own little method, but is there some scientific, medical way to really do it?
Well, there are ways to do it that work for people, and not one technique's going to work for everybody. I see a lot of patients, and they get scared because after 5 or 6 hours of hiccups, they want it to go away. It can be very scary. Some of the things you can do, you can breathe into a paper bag, you can gargle some ice water.
Gargle ice water?
Gargle ice water. You can hold your breath. You can even have somebody scare you.
That really works?
It works because it basically excites your nervous system, which helps get them under control. And my favorite is the last one. Drink out of a cup backwards.
How does that even mean?
Yeah, it's one
Put your lips on the other end?
We actually put it on today.com how to do that. Did a video demonstration of how to do it because it's a little complicated, but I have a very high succh rate with my parents.
For me? A spoonful of sugar.
And that's one of the techniques that work for me.
And it helps the medicine go down.
That's what somebody famous said once.
How do you lower your blood pressure? Was another popular.
So there are some fantastic medicines out there. They're great. They're very effective. But for some people, you can go ahead and treat it at home. Some of the ways you can treat it at home: lose weight. For every 10 pounds you lose, you end up dropping your blood pressure by about 5 points on the average. Eat potassium. We're talking bananas, potatoes, avocados. These are foods rich in potassium. Less salt. I think most people know that. But cut salt out. Exercise, and definitely quit smoking.
Last one is for Mr. Roker. The question.
Well, people want to know, what is keto?
They do.
Right. And in 2018, this was the #1 search for health-related topics.
Really?
In 2019, it dropped to #2, but it's still very, very popular. And essentially, as you know, it's a high-fat, low-carb with some proteins thrown in kind of diet.
Right.
And here's the things you can eat right there on the left side: the meat, the poultry, the seafood. Those ones. The ones they want you to avoid are the breads, the pastas. For some people, like you, Al, this works fantastic. For other people, it's a little hard to stick to, and so they might not be able to do it. But again, it's one of the most searched ones they have out there.
Interesting. A great one to do when you punch it in. It's nice to know you're not alone. That's what I love about Google searches. I'm like, oh, everyone's got that thing.
Especially when you first typing in the words, and all of a sudden they appear.
It just shows up.
Dr. Google.
That was great.
Thank you.
Good segment. We should do this more often.
Thank you.
You got more on the website?
Yeah, we have more on today.com, including my demo on how to drink from the cup backwards.
I'm going to go just to see that.
That's worth it.
That's pretty cool.
All right, Mr. Roker, you got our answers to our weekend weather questions.
One that has always worked for me for the hiccups, but it takes 2 people. Put your fingers in your ears, and then somebody holds a glass of water, and you drink as much as you can. And it is
holding your fingers in your ears.
You have to video that for us, please.
I'm telling you.
It works?
100%. I've done it for folks, for like 50 people, everyone.
What?
Every time.
Today.com. I'm going to put that on the website.
All right, let's put that on the website.